Many people have heard of physical therapy and are familiar with it, but some people are not familiar with all of the aspects of physical therapy and how they can benefit from it. As physical therapists, we're looking to become more of preventative specialists. A lot of times when you have an injury or you're in pain, you think you might need to go see your doctor, which is always fine, but a lot of times your primary care physician will then offer you to seek out physical therapy services. So patients can come in using direct access and not need a referral or a script from their doctor to receive physical therapy services. We will then conduct a full physical therapy evaluation and then determine whether or not their needs are in our scope of practice or if we need to refer them out to a specialist. As preventative specialists, we don't always need to see people when they're necessarily in pain or having some kind of ailment. We can conduct an evaluation to figure out whether or not somebody can benefit from what we do here. So when patients come in for their evaluation, one thing that we ask them is what is a goal that they want to achieve. And oftentimes they'll come in with some sort of thing that's difficult for them to do at home or an ache or pain that they want to address. But using their patient goals to help incorporate our plan of care is really important. That keeps the patient engaged and keeps them compliant with not only coming to physical therapy but doing their home exercises. So whatever the problem might be, whether it's a flexibility issue, whether it's a strength problem, whether it's difficulty getting up from a bench without having to use their hand, that is incorporated into their plan of care. And we always refer back to the patient goals and help to keep them in a better understanding of where they are in respect to reaching their goals. So we're doing consistent progress notes so that they're updated and they get an idea of where they were at the very start versus now where they are maybe 4 or 5 weeks later and kind of where the next step is in their recovery.